Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 40th lecture on pathology. Today, day 6 of Neoplasm. Today's topic is grading and staging of malignant neoplasm. Grading and staging of malignant neoplasm. Dear audience, first come to grading. What we mean about grading of malignant tumor? Level of differentiation of tumor is known as grading. Level of differentiation of tumor is known as grading. Dear audience, we know what is differentiation. Extent of resemblance, extent of similarities of the tumor cell with the normal cell is known as differentiation, and level of that differentiation, level of that similarities of the tumor cell is known as grading. So, it is the level of differentiation. Grading based on degree of differentiation, that is degree of extent of resemblance, that is degree of resemblance of the tumor cell with the normal cell, and it also based on number of mitotic cells in tumor. So, grading of tumor based on degree of differentiation and number of mitotic cells in the tumor. With increasing anaplasia, grading is 4 types. Grading with increasing anaplasia. With increasing anaplasia, 4 types grading. Grade 1, grade 2, grade 3 and grade 4. Dear audience, you know what is anaplasia? Lack of differentiation is known as anaplasia. So, with increasing anaplasia, grading grade 1, grade 2, grade 3 and grade 4. Dear audience, as it based on degree of differentiation and number of mitotic cells in the tumor, grading is done by histopathologist. Grading is done by histopathologist. Now, come to grade 1. Again, we recall level of differentiation is called grading. Grade 1 means well differentiated tumor is called grade 1. So, grade 1 means well differentiation. that is in a malignant tumor, if more than 75% cells are differentiated, that is called grade 1 malignant tumor. So, in this grade 1, more than 75% cells are differentiated. This is grade 1. Now, come to grade 2. Grade 2 means moderately differentiation. Moderately differentiation, that is in this tumor more than 50%, but less than 75% cells are differentiated. Now, come to grade 3. Grade 3 means poorly differentiation. Poorly differentiation, that is more than 25% cells, but less than 50% cells are differentiated. More than 25%, but less than 50% cells are differentiated. Grade 4, grade 4 means undifferentiation, that is here less than 25% cells are differentiated. Less than 25% cells are differentiated. This is grade 1, grade 2, grade 3 and grade 4. Dear audience, again we recall grading is based on degree of differentiation and number of mitotic cells in the tumor, and it is done by histopathologist. Now, come to what are the clinical importance of grading. Clinical importance of grading. Grading is a parameter of clinical gravity of the tumor. A parameter of clinical gravity of tumor. If anybody suffers from carcinoma of lung grade 1 and another body suffers from carcinoma of lung grade 4, definitely grade 1 is a bit better than grade 4. So, it is a parameter of clinical gravity of tumor. It helps in planning of treatment. It helps in planning of treatment. The planning of treatment of grade 1, grade 2, grade 3 and grade 4 not same. It is a parameter of prognosis of tumor. It is a parameter of prognosis of tumor. Increasing grading, bad prognosis. If grade 4 bad prognosis, then the grade 1. So, increasing grading, bad prognosis. So, these are the clinical importance of grading. Dear audience, if we get a report from histopathologist, report of carcinoma of breast like this, breast biopsy, infiltrating duct cell carcinoma, grade 2. What it means? The mother suffers from carcinoma of breast, infiltrating duct cell carcinoma, grade 2. That is, it is moderately differentiated duct cell carcinoma of the breast. Now come to staging. What we mean about staging of malignant tumor? Extent of spread of malignant tumor is known as staging. Extent of spread of malignant tumor is known as staging. Dear audience, we know malignant tumor can spread locally by invasion and can spread in the distant places by metastases. So, extent of spread of malignant tumor is known as staging. Staging based on size of primary tumor, staging based on spread of tumor in regional lymph node and based on presence or absence of hematogenous metastases. Presence or absence of hematogenous metastases. Dear audience, again you recall, extent of spread of malignant tumor is known as staging, and we know malignant tumor can spread locally by invasion and it can spread distally by metastases. So, staging based on size of primary tumor, based on spread of tumor in regional lymph node and based on presence or absence of hematogenous metastases. Dear audience, now come to TNM staging. It is widely used staging, that is TNM staging. Here T stands for size of primary tumor. T stands for size of primary tumor, N stands for regional lymph nodal involvement, N stands for regional lymph nodal involvement, M stands for hematogenous metastases. Widely used staging TNM staging. T stands for size of primary tumor, N stands for regional lymph nodal involvement, M stands for hematogenous metastases. Dear audience, now come to T, that stands for size of primary tumor. With increasing size of primary tumor, T may be, with increasing size of primary tumor, T may be T1, T may be T2, T may be T3, T may be T4. Dear audience, suppose this is female breast and there is a carcinoma in the breast, carcinoma breast, and this is the primary tumor P, this is the primary tumor of the breast. I have told you with increasing size of primary tumor, T may be T1, T2, T3 and T4. Suppose T1 means 2 centimeter diameter of the primary tumor. Again, suppose T1 means 2 centimeter diameter of the primary tumor. If T1 is 2 centimeter, with increasing size of primary tumor, T2 is 4 centimeter diameter of the primary tumor of the breast, T3 6 centimeter diameter of the primary tumor of the breast, and T4 is more than 6 centimeter diameter of the primary tumor of the breast. So, with increasing size T may be T1, T2, T3, T4. Now come to N. Dear audience, N may be N0, N0, N1, N2, N3. N0 means there is primary tumor, but no spread to regional lymph node, that is no regional nodal involvement, no regional nodal involvement. N1 means 1 or 2 ipsilateral nodal involvement, 1 or 2 ipsilateral nodal involvement. That is, if a mother suffers from carcinoma breast right side, N0 means carcinoma breast is there, but in the right side or in the left side there is no nodal involvement. If mother suffers from right sided breast carcinoma, N1 means on the right side 1 or 2 nodal involvement, that is 1 or 2 ipsilateral nodal involvement. N2 means more than 2 ipsilateral nodal involvement. Again, if mother suffers from right sided carcinoma of breast, N2 in that case means on right side more than 2 nodal involvement. N3 means contralateral nodal involvement. This is N. It may be N0, N1, N2 and N3. N1 means ipsilateral 1 or 2 nodal involvement, N2 means more than 2 ipsilateral nodal involvement, N3 means there is contralateral nodal involvement. Dear audience, now come to M, that stands for hematogenous metastases. This M may be M0, M1. M0 means there is carcinoma in the organ, but there is no hematogenous metastases. Absence of hematogenous metastases. M1 means carcinoma is there with presence of hematogenous metastases. This is all about the TNM staging. T stands for size of primary tumor, N stands for spread of tumor in the regional lymph node, M stands for presence or absence of hematogenous metastases. Dear audience, now come to type of staging. Staging may be clinical staging of a malignant tumor and pathological staging of a malignant tumor. So, staging may be clinical staging and pathological staging. Now, come to example of clinical staging and pathological staging. In case of carcinoma of breast, the clinical staging. So, clinical staging in case of carcinoma of breast based on physical examination of patient, based on result of mammogram, based on result of ultrasound, and based on result of MRI scan. Dear audience, example of clinical staging in case of carcinoma of breast, clinical staging based on physical examination of patient, result of mammogram, result of ultrasound of the breast and result of MRI scan. Now, come to pathological staging in case of carcinoma of breast. It is based on what is found in breast tissue and in lymph node after surgery. Based on what is found in breast tissue, in lymph node after surgery. So, this is pathological staging, that is based on what is found in breast tissue, what is found in lymph node after surgery. So, this is clinical staging and pathological staging. Now, come to importance of staging. Dear audience, again recall, extent of spread of malignant tumor is known as staging, and in staging size of primary tumor is considered, regional nodal involvement is considered, and hematogenous metastasis is considered. So, importance of staging, it is the parameter of prognosis of tumor. It is the parameter of prognosis. Another one, it helps in planning of treatment. Planning of treatment. So, these are the importance of staging. Dear audience, if three mother come to you with carcinoma of breast, first mother see a breast, right side, T1, N0, M1. Second mother, see a breast, right side, T4, N0, M0. Third mother, see a breast, right side, T4, N3, M1. What it means? It means right-sided see a breast. It means right-sided see a breast, carcinoma breast. Size is smaller one. There is no regional nodal involvement, but there is hematogenous metastasis, but there is hematogenous spread. Second mother, carcinoma breast, right side, T4, N0, M0. What it means? It means the largest size of tumor in the right breast, but there is no nodal involvement and there is no hematogenous metastasis, although the size of the breast carcinoma is huge one. Third mother, see breast, right side, T4, N3M1. What it means? It means the largest size of tumor in the right side of the breast, there is contralateral nodal involvement. That is right-sided breast carcinoma. On the left side, there is involvement of lymph node, and there is presence of hematogenous metastases. So this is staging. This is grading of tumor. Grading is level of differentiation. Staging is extent of spread. Dear audience, today up to this. Thanks all.